I'm going to snake my hand under this arm. And what I need from you is to... Oh, that's gone. I'm just going to shut up. Oh, whew! Same technique. I'm going to snake this arm under here. I'm going to shut up now. Relax the upper body. There we go. Good job.
It freaks me out.
It freaks you out, eh? You're okay. Big breath in, big breath out. Awesome. You're all good. You did well. Daniel, good to meet you today.
Good to meet
thanks
you.
Thanks for coming in. Sorry about the trouble in finding the place. It's only hard to find once. All right, so Daniel's in today. He is the brother of one of my regular patients, but I'm going to let him kind of talk about what it is that he's dealing with. So Daniel, what are you in for today?
Yeah, thank you so much for meeting me. So my name is Daniel. I've been experiencing some sort of upper back I don't know if it's stiffness or soreness, but with exercise and with stretching, it usually calms down, goes away.
Okay.
But after a run this weekend, I kind of felt it upper back, right side, here.
Okay.
I took a rest day
It's
yesterday
improved a bit
and then
since.
improved, but just generally speaking, this whole year I've just had more upper back, and I've never had that ever.
So that's new for you, right? That tension?
Yeah.
Okay. All right. So Daniel kind of showed me off camera, and I'll show you guys a little bit in a minute too, but that he's pointing right to what's called the TL junction, where your upper back becomes your lower back, specifically on the right side. Very common area of tension that develops. I'll get more into detail as to why for you when we are doing the examination, but that happened yesterday. Mm-hmm. Yes. Oh, no, that happened 2 days ago, excuse me. And yesterday you took a rest day, and it's feeling better now?
Yeah.
Okay, good.
Usually what makes it feel the best is just actual exercise, moving my back and stuff that has calmed it down.
Good.
Because I work from home, just sitting down basically.
Like a desk.
Yeah, exactly. So when I wasn't being as active, it was flaring up more.
Probably.
But then with activity, it...
Completely correct. It's an old narrative that you need to rest or be still maybe for 24 to 72 hours, but then movement is the thing that helps a lot of these musculoskeletal conditions. So you figured that out yourself. Good. Very, very good, because a lot of people still don't know that, but be proud of that. Okay, so you're saying it's in that middle back. You kind of mentioned to your upper back. Where are you referring to, your traps almost, up here, or is it really just you're referring to that one area there?
It's always been sort of upper back, in between that and middle back.
Okay.
Kind of again, this time it's here, but when I've had
it ranges. It's not always there. Sometimes it's higher up.
This one was from the running, I guess. I don't know, but usually I do a lot of Y exercises and stuff that, and that alleviates
YTW type stuff.
Against a wall.
Yeah.
Kind of
thing. Wall angel type stuff.
Yeah.
Okay. Yes.
Or I've done.
Or you'd stretch out the traps like that. Okay.
Yeah. Even going this, lowering my neck, I feel...
You probably feel that back there right now?
Yeah.
Okay. Yeah, got it. Okay, so yeah, stretching out of the traps, they stretch all the way down to the TL. It makes sense that you're feeling them down there too. Okay, any other concerns? Was that really your primary focus for today? It's just that kind of recent aggravating, but also the reoccurring aggravation of a bunch of upper back, different complaints.
Yeah.
You're good?
That's
perfect.
That's the main.
All right, so if that's the case, what we're going to do today is we're going to do a physical exam, okay, including a range of motion exam. Try to figure out if what I think is going on is what's going on, and then we're going to treat it, okay? Hopefully get you feeling better.
Yeah,
awesome.
No, that's awesome.
We're going to get started with our usual range of motion exam for both the neck as well as the upper back TL area. We are going to be doing the neck because he was talking about some trapezius muscle tightness, so I want to make sure we're screening that as well. Now, let's get started by getting you to bring your chin down to your chest for me there, Daniel. Now, you're saying that you feel a pulling sensation kind of all the way down, right into that complaint area, eh?
Yeah.
Okay, now if I go ahead and I actually push this further, better, worse, or the same?
I feel it more.
More so? Okay, come back up. I want you to look up towards the ceiling for me. How's that? That's okay?
Yeah, I don't feel anything.
Now if I go ahead and pull it further, that's still okay?
Yeah.
Awesome, good, look forward. Rotate your head as far as you can to the right. Check your blind spot. Good, so we can get to about 50 degrees. Rotate as far as you can to the left. We can get to 50 degrees, so that's equal bilaterally. Good, face forward. Tilt your right ear to your right shoulder, please. That's about 45, 50. Left ear to left shoulder. That's a little bit further. We can get to about 55, 60, but that's okay. Not much of an asymmetry. All right, I want you to give yourself a really tight hug for me. Really tight hug. Good. Now I'm going to get you to rotate as far as you can to the left. Does that provoke anything down there?
Yeah.
Yeah? Okay, now we can get to about 45. There we go, when you're pushing it. And now I'll get you to rotate as far as you can to the right. Less so on that side, huh? Does that provoke discomfort there?
A little bit, like not.
So what I'm seeing,
too bad.
what I'm seeing is that he can't rotate as far to the right as he can to the left. There you go. When he pushes, it's a little further, but there's still an asymmetry there. Here we get to about 30 degrees, other side 45. That is in line with getting muscular spasms on this side. So very likely that we are dealing with that TL paraspinal issue. And paraspinal just means the muscles next to the area there. So overall, it doesn't look serious at all, as we weren't expecting it to. But still, just want to let you know that that looks good. Okay, bring both arms up. Keep them there. Don't let me move them. Fight, fight. Don't let me move. Good. Fight, fight. Don't let me move. Good. Bring your arms forward. Curl the wrists backward for me, okay? Good. Good. Turn over. Curl the wrists inward. Nice. Same deal. Good. Good. Fingers curled. Keep them strong. Keep them strong. Oop. Little adjustment there. That's fine. Good. Then turn over. Fingers straight. Please gently squeeze mine. Good. I have to stay gentle because one guy nearly broke my hands one time, and that wasn't a good day. All right. Let's do reflexes. We'll start over here. Relax the arm, good, good, good. And drop this into my hand. Just give me the full weight of your arm. Relax it. Good, good. Same deal over here. We're gonna turn that over. Relax the arm. Good, good. And bring this up. Drop into my hand, good, good. Nice. That's a normal upper limb neuro. My hands are going on your back now, okay, Daniel?
Okay.
Okay. So, you're saying it was the right side, yes?
Yeah.
Okay. Yeah, so is it right around there, about? Or is it a little higher?
It's like, yeah, like around there, more to like the right side a little bit.
More to the right. Okay, sorry, something fell over there. So one thing that I'm noticing immediately with Daniel is I'm comparing the sides right at that TL junction of the paraspinal muscles. Now remember, the paraspinal muscles, para means next to, spinal means spine, so the next to the spine muscles run all the way the length of our entire spine. But in this area, specifically around the TL junction, he's got a noticeable asymmetry between them, with the right side being a lot more clenched down as compared to the left. Okay, so what that tells me is that at a minimum, we've got a big muscle tension component to what's going on there. We still don't really know about fascia. We don't really know about the joint structure itself. Did this clamp down to try to prevent movement of the joint? Did the joint, I got that. No, that makes sense. Did this clamp down to prevent movement of the joint, or did this just clamp down itself, which now restricts joint? It's a chicken and egg scenario. It doesn't matter if you do a diversified approach. So we're going to treat all of the structures today and hopefully try to free that up, get you back to running pain-free as soon as possible. Haven't had my second coffee yet. That's why we had to slip up. Oh, there was a little freebie right there. Okay. Breathe if you need to, buddy. I hear you up there. Okay, now, it goes all the way up, actually. Now, you say you have reoccurring upper back issues too.
Yeah, during the beginning of the year especially, but it eased up with exercise and stretches.
So, the activity decreased it then for you. Good. Okay, I'm going to adjust this upper back component. We'll get to this in a minute, okay? But you've never had your back adjusted before by a chiro, have you?
No.
No, okay, so here's what I need. First thing I need from you is to take a big breath in for me. on all the way out, all the way out. And the second thing I need is for you to not know I'm about to do it. So good job. Breath in, all the way out, all the way out. One more in, all the way out. There we go. Good job. So we got some pretty good releases in the upper back there. You probably felt those. How were those? You okay?
Good.
Good. You can still breathe, ladies and gentlemen. Okay. Good stuff. All right, so we're going to set you up in position here. I'm going to pull this to get you off your shoulder there. Good. And I'm going to get you to put this hand in your armpit for me, okay? Hold it right there. Bring this leg up, and I want you to scoot your hips close to the edge here. Don't be afraid. I promise you won't fall, okay? So, from this position, again, I'm going to pull this hand and armpit there. I'm going to snake my hand under this arm. And what I need from you is to... Oh, that's gone. I'm just going to shut up. Oh, whew! That was a big one, eh? You okay?
Yeah.
Awesome. Loved that. Glad I didn't talk. All right, let's get you on the other side, okay? Bottom leg straight for me, please. Top one bent. Good. I'm going to take this. We're going to pull, pull, pull. Good. Bring this up here. Nice. Hold right there for me. Going to scooch the hips towards. Nice. Sorry, put this hand in the armpit once again, please. Good. Same technique. I'm going to snake this arm under here. I'm going to shut up now. Relax the upper body. There we go. Good job.
It freaks me out.
It freaks you out, eh? You're okay. Big breath in, big breath out. Awesome. You're all good. You did well. So we found on our palpation here that we've got quite a bit of tension through the right-sided paraspinals as compared to the left. Now, it actually does kind of feel like it's decreased just a bit from that adjusting alone, so it's possible that we have improved it already a bit. But I, of course, because it's a muscle, I want to go in and work it in a way that the muscle would respond to more readily. So that's going to be our instrument-assisted soft tissue therapy for the fascia, and then also our hands to calm it down a bit more. So let's get right into it. Now, Daniel, usually at this point in time, I ask patients questions about themselves to give them a chance to talk about themselves, whatever they want to, so the audience can connect with them. Now, I mentioned earlier that you are the brother of a previous patient here on the channel, and you've got a YouTube channel with them. Do you want to talk about that for a bit?
Yeah, me and my sister have a music duet called Fonts the Duo. We make indie folk, alternative kind of acoustic music. And we're on Spotify and everything, and it's just it's fun.
I have one of your stickers actually right here that your sister gave to me. So Fonts the Duo, there we go. I'm showing it on the camera right now. That's their logo. So if you want to look them up, hopefully that doesn't come up reversed or backwards on the camera. But yeah, you guys should take a look at them, check them out, give them a subscribe and a follow or whatever it is on Spotify. But no, I love that kind of music, and it's really cool that both you and your sister have the talent to do something like that. Little jealous. I gave up piano in grade 4, but wish I kept up with it. What are you vocalist? What do you play?
I sing, I play guitar, bass, piano a little bit.
God.
Learning violin, banjo a bit.
Are you single?
No.
I was gonna say, ladies, he's single, but jeez, he's a talented guy. Damn.
So, I don't know. I like to learn a little bit of like everything,
Mm-hmm.
so it helps with production and stuff.
Okay, you doing okay?
Yeah.
All right. Some people find this irritating. I call those people weird, but it definitely can be a little bit intense in some situations. All right. camera's really off-centered. Here we go. That looks better to me. Yep. All right, once again, Daniel, massage gun. Daniel, how did you find everything that we just did?
It was interesting. I've never had my back like realigned or anything, and I didn't expect that many like cracks. But it wasn't as like bad or like as like it's not like it hurt or anything.
Yeah.
I think the toughest part was actually the massage.
Really?
Yeah, I think that was the toughest.
So, not surprising to hear that. A lot of people, if you haven't seen a chiropractor before to get your back adjusted or your neck adjusted or whatever it is, it's easy to work it up in your head, especially if you're watching YouTube videos like this one and you're hearing either like that sounds painful. You think it is, but it's really not. It can be a little shocking sometimes, which I think you'll agree that it was probably a little shocking.
Yeah.
But yeah, the massage work is usually more painful than the actual adjusting is. So if you're at home debating to see a chiro for for whatever issue you have related to your back, don't freak out. Just go. They'll walk you through it all. But very common that I hear that. I'm glad you put on a brave face. I didn't even realize that you were actually stressed out about it. You seem quite good. You seem quite relaxed, which is awesome. That's exactly how you should be, because what we do in here is very safe. Very, very safe. Any other questions or comments, concerns about what we've done today, about what exactly is going on with you? You don't have to ask me questions. You can ask me off camera too if you're more comfortable, but I wanted to I always give the patient the opportunity to authentically ask.
No, I guess just like next steps or like what I can do.
Yeah, so you're already doing the best possible thing that you actually can do for this, which is keeping movement up, okay? Like I talked about earlier, some people still think that like, oh, you injured yourself, you should immobilize, you should be still, you should relax. That's only really true if A, the injury is quite severe, and B, if that's the case, it should be for as little as possible, all right? Like movement is the thing that really does help to heal these musculoskeletal issues, and then loading helps that as well. So, moving heavy things versus just moving body weight. So with the TL junction specifically, we can absolutely work on mobility of the upper back, which I'll show you some stretches once we turn the camera off here, and that's only because the algorithms have proven to me, guys, that you guys don't care about exercise. So if I show them, you guys click off. So I'll show them afterwards instead. But thoracic mobility will help quite a bit, and we'll walk through that too. But otherwise, this is something that can definitely be managed and shouldn't be stressed about that much.
Okay.
Any other questions?
No, I think that's good.
Awesome. All right. Well, thank you so much again for coming in, Daniel. Really appreciate it. And see you soon.
Yeah, for sure. Don't forget to like, comment, share, and subscribe.
Thank you, Daniel.